I am excited to be interviewing Cyrus Khambatta today. So Cyrus Khambatta, PhD, is a co-founder of Mastering Diabetes and is an internationally recognized nutrition and fitness coach who has been living with type 1 diabetes since 2002. Using an evidence-based approach to nutrition and fitness, he first reduced his own insulin usage by more than 40% and has educated thousands of people with all forms of diabetes how to reverse insulin resistance using diet and exercise. Cyrus earned a Bachelor of Science in Mechanical Engineering from Stanford University in 2003, then earned a PhD in Nutritional Biochemistry from the University of California, Berkeley in 2012. It's good to have you here, Cyrus.
Awesome. Thanks so much, Robbie. I totally appreciate it.
So you have an interesting story of being diagnosed with type 1. So tell our viewers your story and how you got interested in plant-based nutrition.
Yeah, so I was diagnosed with type 1 diabetes at the age of 22, which is a relatively late diagnosis in the world of type 1. At the time I was a senior in college, it was 2002, and I was just trying to graduate. I was just trying to go through finals. I was just trying to get out of college so that I could actually start working and be done with the college experience. And at the very end of the year, it was about November, and I felt terrible. I mean, I was urinating 20 times a day like clockwork every 30 minutes. And I was drinking everything under the sun. I would drink a glass of water, put it down, and I'd be like, yep, I'm thirstier. Then I would drink another glass, put it down. Yep, I'm thirstier. And, for a 24 to 48 hour period, I was going insane because I was like, this is weird. I don't understand what's happening. And, in hindsight, a lot of my friends had told me that at that very same time, my energy levels were really low. So, it didn't matter whether I ate food or whether I exercised or how much I slept. I was kind of just dragging everywhere I went. And then sometimes I would eat a plate of food and I would almost fall asleep like at the table while I was, right afterwards. So what I did was I picked up the phone and I called my sister, who's a doctor of osteopathy. And I said, hey, Shanaz, I'm experiencing all these symptoms. What would you recommend? And she started crying immediately. She said, Cyrus, please drop everything you're doing. Just go straight to the doctor. And I was like, what's the big deal? I don't understand. She says, everything that you're describing is type 1 diabetes. I don't have time to explain, but trust me, this is very dangerous. Go to the doctor. I said, fine. So I show up at the doctor, and this is like the on-campus health center. And a nurse checks me into my room, and she measures my blood glucose at a 680. I mean, it was just sky high, right? You're supposed to have a blood glucose of approximately 100 or between 80 and 130. Mine was 6 times higher than it needed to be. So they transported me to the hospital. I end up getting to the hospital within half an hour. And here I have an IV of fluid going into one arm of saline, and then I have an IV of insulin going into my other arm. And all of a sudden, here I am, a patient in the hospital for the first time in my life. So while I was at the hospital, the team of doctors basically said, all right, let's go through your medical history. And they kind of walked me, from the time I was born all the way through to this moment in time. And what we had pieced together as a team was that I had developed not 1, not 2, but 3 autoimmune conditions within the span of 6 months. So the first one is Hashimoto's hypothyroidism, which is thyroid dysfunction. So it's a reduction in the amount of thyroid hormone that my thyroid gland produces. And that's an autoimmune version of hypothyroidism. Then within a couple of months after getting diagnosed with Hashimoto's, I ended up getting alopecia universalis, which is why I have no hair, I have no eyebrows, I have no ear hair, nose hair, nothing. I'm completely hairless. That didn't always used to be the case. I used to have hair, and then it just all of a sudden decided to leave about 2 months after this Hashimoto's diagnosis. And then I get diagnosed with type 1 diabetes, and all of that happened within 6 months. So I was scared. I was definitely scared. And the doctors actually looked at me and they said, can we talk about you at our next team huddle? And I said, sure, why? And they were like, because we've never seen anybody with this combination of autoimmune disorders before. This is fascinating. And I was like, sure, do whatever you need to do. Doctor leaves the room. And I sat there and I was like, they've never seen this before? Like, what is going on? I don't understand. So I ended up leaving the hospital with a blood glucose meter, a prescription for insulin, a carbohydrate counting guide, test strips, syringes, and a whole bunch of fear. And I was like, God, what just happened to me? Like 24 hours ago, I was non-diabetic, and now I have this thing and I have to monitor. Like, I don't even understand what's going on. So because I was so scared, I ended up listening to the advice of the doctors. And their advice at the time was, they said, listen, the only way to control type 1 diabetes is a low carbohydrate diet. That's all you can do. right? Because carbohydrates are your enemy. The more carbohydrate you eat, the more insulin you're going to need, the harder your life is going to be. Don't eat carbohydrate-rich foods. I said, fine. So this book I was carrying around with me basically told me the carbohydrate value of all the foods I was eating. So, I tried to reduce my breads, cereals, pastas, fruits, potatoes, and rice. And I said, okay, great. I'll reduce those. And in substitution, I get to eat more meat. Now, at the age of 22, you're telling me I get to eat more meat. I'm a happy camper. I grew up eating meat and dairy. So, you're telling me exactly what I wanted to hear. So I did that for a year. And man, my life got harder and harder. So I was already low energy. And I was injecting, insulin to try and control my blood glucose. And then I got lower energy. And then I got lower energy. And then I got anxious. And then I got depressed. And then this whole process started to spiral out of control. And I recognized about a year into this process that not only was I not able to exercise the way I wanted to, not only was I waking up angry, not only was I depressed, not only was my blood glucose impossible to control, but I felt like I literally had no idea how to control my health. I didn't know what was wrong. I didn't know what was causing any of this stuff. All I knew was that I felt terrible. My blood glucose was this ridiculous, uncontrollable roller coaster. My blood glucose meter was basically a random number generator. And I was very, very nervous still. So long story short, I ended up seeking out alternative health information, alternative health information, which at the time in 2003 was, considered a vegan lifestyle. And having grown up as a meat and potatoes and dairy eater, I used to make fun of vegetarians and vegans. People would tell me I'm a vegetarian and I would say, sorry, it sucks for you, right? But here I was at the age of 23, now considering maybe being a vegetarian because the information that I was learning about it was actually very powerful. Story after story after story of people who had, reduced their need for medication, reduced their need for insulin, gotten off of oral medication, reversed other complex chronic diseases. I was like, wait a minute, is this really a solution? So under the guidance of a nutrition guru at the time, his name's Doug Graham, who's gone on to write a book called the 80-10-10 diet, he taught me basically how to eat nothing but fruits and vegetables. Not only how to eat fruits and vegetables, but why eating fruits and vegetables was actually a really effective solution for controlling my blood glucose and making me feel 1,000 times better. So under his guidance, I started to make all these changes. I became a vegan overnight because I was in a lot of pain, physical pain, emotional pain, mental pain. And it was a night and day experience. I mean, I remember the very first day I changed to being a vegan. Within 24 hours, my blood glucose started tanking. So here I am eating, just like you, Robbie. I'm eating in ridiculous quantities of carbohydrate-rich foods, lots of fruits, lots of mangoes, lots of bananas, lots of dates, lots of papayas. And here I am expecting that my blood glucose is going to go through the roof because I'm eating a lot of carbohydrate-rich foods. But yet, the more carbohydrate I ate, the less insulin I needed. And over the course of time, I began to learn that my blood glucose, or controlling blood glucose, has something to do with carbohydrate, but it has a lot more to do with your total dietary fat, and we can go into that in a little bit more detail. So fast forward, I changed my diet. I feel great. Blood glucose is controlled like a champ. Insulin use cut by 40%. Have so much more energy. Start returning to exercise. I got so excited. I went back to school. I taught myself, a lot about nutrition. I enrolled in a PhD program. I went to UC Berkeley for 5 years to study insulin resistance because I wanted to understand what was happening inside of here from a scientific perspective. And once I started to understand that, I started to ask a bigger question, which was, is it possible that other people living with type 1 diabetes or pre-diabetes or type 2 can also benefit from a similar approach? And then hence the beginning of, low-fat, plant-based, whole food nutrition to reverse insulin resistance and mastering diabetes. And here we are today.
Yeah, your story is amazing. It never gets old. And, just hearing like what happened in that first week is so amazing, how quickly things change. Okay, so you have been said, I've heard you say this many, many times, diabetes is the best thing that ever happened to me. You say that. Are you joking? Are you serious? What's up with that?
No, absolutely. Absolutely. People look at me with 4 eyes when I say that diabetes is the best thing that happened to me because, think about it. Your average person living with diabetes, especially type 1 diabetes, just wants to get rid of it, right? I see this all the time in the type 1 diabetes world. The question is like, When is a cure coming? When is the cure coming? Is it cured yet? Can I go get a surgery? Is there a device I can use that will cure it? I want this gone. What is this thing inside of me, right? And then people living with prediabetes and type 2 diabetes, the whole name of the game is reverse, 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 get rid of, eliminate, reverse, right? Now, if there was a magic pill that I could take today that would eliminate type 1 diabetes, I swear to you, I would not take it. I would not take it because I don't want to get rid of type 1 diabetes. And the reason is simple. Type 1 diabetes is the most educational thing that's ever happened to me. And it's enabled me to learn more about myself and learn more about how to control my health and how to optimize my health than any other book I've ever read, than any other experience I've ever had. And if type 1 diabetes never affected me, I would probably have deteriorating health right here and right now. But because type 1 diabetes affected me at a young age, and because I was fortunate to have developed type 1 diabetes at the age of 22, I now have better health than I've ever had in my life. I have better health today than I had a year ago, than I had when I was 30, than I had when I was 22. I have better health now than I had when I was 10 years old, and I guarantee you of that. And so, type 1 diabetes to me literally is a gift. And yeah, there's a little bit of frustration every once in a while. I check my blood glucose and it's high or it's low and I don't understand what's happening. But that's this percentage of the time, because a low-fat plant-based whole food diet is very effective at controlling blood glucose. 95+% of the time, I'm a really happy camper and I wouldn't trade that for the world.
It's a beautiful perspective. It's really beautiful. So you studied your entire PhD on the causes of insulin resistance. Can you tell our viewers what insulin resistance is and what causes it in the first place?
Absolutely. So what I think I would like to do, let me share my screen here and show you guys some slides. Now, when it comes to understanding insulin resistance, it's very important to understand that insulin resistance is the root cause of all blood glucose variability. So it doesn't matter whether we're referring to people with type 1 or prediabetes or type 2 diabetes or gestational diabetes. Insulin resistance is caused by the storage of excess fat in tissues that are not designed to store fat. So let me walk you through these slides so that you really understand exactly what I'm talking about. Okay, insulin resistance is a dysfunction of your muscle and your liver tissues. It's not primarily a dysfunction of your pancreas, although it can progress to be that way. So under normal circumstances, when you have what's considered normal glucose metabolism or non-diabetic healthy glucose metabolism, there's some amount of glucose shown here in blue that's floating in your blood. And this glucose is mainly used by your brain 24 hours a day to think properly and to function properly. But this glucose is also used by tissues all throughout your body. Your heart uses it, your lungs use it, your muscle uses it, your liver, your pancreas, your gallbladder, every tissue in your body uses glucose. Now, in order for glucose to get inside of tissues, it has to be escorted by insulin. So insulin is also floating in your blood, and insulin is manufactured by your pancreas. So under normal circumstances, insulin directs glucose into your tissues. One tissue that glucose can get inside of is your liver. Another tissue that your glucose wants to get inside of or can get inside of in large quantities is your muscle. So when this happens, insulin is able to direct both your liver and muscle into storing glucose or using glucose to burn for energy right here and right now. Now, when you eat a low carbohydrate diet, what ends up happening is that the food that you're eating is lower in its carbohydrate value. So there's less blue and there's more what I put here in yellow. Okay, so there's more fatty acids that are present in low carbohydrate foods, such as meat, cheese, eggs, avocados, oils, fish. Any of these foods that are low carbohydrate are de facto higher in fatty acids and higher in protein. Now, when you eat a diet that's low in glucose or low in carbohydrate and higher in fatty acids, those fatty acids end up getting partitioned into tissues just the same way that glucose did. Now, the fatty acids can get into either your liver tissue or your adipose tissue, which is your fat tissue, or your muscle tissue. They can also get into tissues all throughout your body, but those are the three primary targets of fatty acids. Now, if fatty acids ended up going directly into your adipose tissue and only your adipose tissue, then diabetes would not exist. We would not have it as a condition, okay? I should say pre-diabetes and type 2 diabetes would not exist. But the problem is that over time, as you continue to eat a low carbohydrate diet, this accumulated fatty acid buildup ends up depositing fatty acids inside of your liver right here and fatty acids inside of your muscle. So when these two tissues start to over accumulate fatty acids, then the next time you go try and eat something that is carbohydrate rich, like a banana, or maybe a bowl of quinoa, or maybe a potato, insulin's job is to try and knock on the door of the tissue and say, hey, tissue, there's some glucose in your blood. Would you like to take it up? Now, tissues can respond by either saying, sure, and then they open the door and they allow glucose to come inside, or they can respond by saying, I can't take that glucose up, and here's why. Now, in this situation, what insulin does is it says, knock, knock, muscle, do you want some glucose? Because Cyrus just ate a banana, and there's glucose freely available in your blood. And the muscle tissue responds by saying, sorry, I can't do that right now. Take a look at what I have inside of me. Do you see all this accumulated fatty acids that have built up over time? I absolutely cannot take up the glucose right now because I'm full of energy. And in order for me to take up that glucose, I have to get rid of this fatty acids first. So glucose then gets trapped. It can't get inside of your muscle. It can't get inside of your liver. I should say this. It does get inside of your liver and muscle, but in small amounts, not in very large amounts. And so as a result of that, glucose ends up getting trapped in your blood, and it starts to accumulate. So it gets trapped in your blood. There's more glucose. You check your blood glucose, and you start to see higher numbers. And then as a result of that, if your pancreas is functioning, your pancreas will then say, hey guys, listen, I can solve this problem. Let me just make more insulin. So your pancreas starts to increase its insulin production, not by 20%, not by 30%, but by 200, 300, 400, sometimes as much as 500%. So we're talking a 5-fold increase in insulin production. And so as a result of that, you end up with lots of blue or lots of glucose in your blood, giving you high blood glucose or hyperglycemia. You end up with a lot of fatty acids in your blood coming from your diet, which is hyperlipidemia. You also end up with large amounts of insulin in your blood, which is called hyperinsulinemia. So all three of these have now elevated. And as a result of that, it's very easy to develop insulin resistance inside of your liver, inside of your muscle, and then also end up depositing fatty acids and lipids inside of blood vessels. And when this process happens, you end up with, a triple whammy. You get an insulin resistant, these words are switched. This should be insulin resistant muscle. This should be insulin resistant liver. And then you can end up developing atherosclerosis, which is hardening of blood vessels due to an excess accumulation of fatty acids inside of your vasculature. Now, when you eat a low-fat diet, what ends up happening instead is that you have more glucose, more of the blue, and very small amounts of yellow, okay? A low-fat diet is not a no-fat diet. It's impossible to have a no-fat diet. So there is a small amount of fatty acids available. Now, insulin can easily communicate with both your muscle and your liver because it says, knock, knock, do you want this glucose? Cyrus just ate a banana. And the tissues respond by saying, sure. Look, I don't have that much lipid inside of me. I don't have that much fatty acids. I'm open for business. So the glucose goes inside of your liver, it goes inside of your muscle, and then it ends up getting deposited inside of both of those tissues to be burned immediately or to be stored as glycogen for later use. So in this situation, you end up with an insulin-sensitive, again, liver, an insulin-sensitive muscle, and then an elastic vasculature, which enables you to mitigate your risks for developing vascular damage over the course of time. So, if you remember nothing from this, all I want you to remember is that the accumulation of fat in your muscle and liver traps glucose in your blood. And this right here is what causes insulin resistance.
Okay, so this is very clear, very easy to understand. Thank you very much for that beautiful presentation and being able to see the visuals. Really love that. So most people think that insulin resistance only affects people living with pre-diabetes and type 2 diabetes. But you say that it affects everyone living with diabetes. So why is that the case?
Okay, so you're right. Lots of medical professionals will associate insulin resistance with only pre-diabetes or type 2 diabetes. And a lot of people living with diabetes also make the same mistake. It turns out that there's sort of three different flavors of diabetes, the way I like to think about it. The first one is autoimmune diabetes, which is type 1 and type 1.5. So type 1 is what I have. It's what Robbie has. It's what you develop generally as a juvenile when your pancreas, when the beta cells in your pancreas experience an autoimmune attack and can no longer manufacture insulin. Type 1.5 diabetes is the same condition, except it happens later in life. So it's adult onset, slow progressing type 1 diabetes. Now, the second flavor of diabetes is called lifestyle diabetes. This is prediabetes and type 2 diabetes, and this right here is most strongly associated with insulin resistance, just as I previously described. And then the third sort of flavor of diabetes are two flavors of diabetes that actually happen to women. The first is gestational diabetes that happens during pregnancy. And then the next one is called polycystic ovarian syndrome. Now, technically speaking, PCOS is not a version of diabetes. So I do not mean to insinuate that people with PCOS have diabetes. What I am saying is that people with gestational diabetes and polycystic ovarian syndrome have a lot of insulin resistance. And so as a result of this, these two can be grouped together because they affect primarily females, and they both have insulin resistance at their core. Now, insulin resistance is the central connecting puzzle piece that communicates with type 1 diabetes, that communicates with lifestyle diabetes, that communicates with gestational diabetes and PCOS. And so insulin resistance is this central node. And whenever you increase your risk for insulin, or when you increase insulin resistance, that means that your life as a person with any version of autoimmune diabetes, lifestyle diabetes, or gestational diabetes or PCOS becomes more complicated. But not only that, the beauty of this is that insulin resistance is also a central node that controls or influences many different chronic diseases within your body. So, all of these versions of diabetes that I just discussed are right up here on the top right. But the more insulin resistant you become, the higher your risk for cancer, for coronary artery disease, for hypertension and atherosclerosis, for obesity, for high cholesterol, for things like fatty liver, which is a huge, huge, huge problem in the world of diabetes. Now, people who develop more insulin resistance also increase their risk for Alzheimer's disease or cognitive decline, as well as peripheral neuropathy, blindness, kidney failure, retinopathy, and erectile dysfunction in men. So it's very important to understand that insulin resistance is not just something that affects people with prediabetes and type 2 diabetes. In fact, there are millions of people, if not now maybe even close to 100 million people in the United States that are living with insulin resistance and have no idea.
This is fascinating. Now, here's the $1 million question. How long does it take to reverse insulin resistance?
Ooh, great question. Phenomenal question. Okay. So when we talk about reversing insulin resistance, really what we're talking about is eating a low-fat, plant-based whole food diet so that you can clear the accumulated fatty acids that have been stored inside of your muscle. Okay. It's everywhere inside of your muscle, and it's also inside of your liver. Now, does that process take a day? Does it take a week? Does it take a month? Does it take 5 years, right? How long does that process take? Now, the answer is, it depends. It depends on a number of things, okay? It can take a very short time. It can take a very long time. The things that will determine the speed at which insulin resistance is reversed in your body include, what is your current diet? How much fatty foods have you been eating over what period of time? Are you eating maybe like a Mediterranean diet that's got maybe like a medium quantity of total fat and maybe a lot of it's coming from plant-based fats? Or are you eating a ketogenic diet that's very high in fat and a lot of it is coming from animal-based sources, which contains more saturated fat? The two of those are completely different scenarios. The person who's in the ketogenic category is going to have it's going to take longer for them to reverse insulin resistance. So another thing that's really determines how long it takes is your body weight. If you're at your normal ideal body weight, then it's going to be a lot easier to reverse insulin resistance than if you're 20, 30, 40, 100 pounds overweight. How active are you? Do you move your body on a daily basis? Yes or no? Are you moving your body for 15 minutes a day with a moderate heart rate? Or are you an endurance runner and you're running for 4 hours a day at an elevated heart rate? Okay. How much accumulated environmental contaminants do you have in your body and your adipose tissue as a result of your occupation, as a result of eating packaged, refined, and processed foods over the course of time? Okay? Another thing that affects your level of insulin resistance is the status of your microbiome. And you're going to hear this in our summit from other speakers who talk about the fact that your microbiome is, think of it as your immune system that's where it's housed inside of your large intestine. And so if your microbiome is experiencing what's called dysbiosis, and there's a whole collection of pathogenic bacteria inside of there that are wreaking havoc on your immune system, they're also going to wreak havoc on your ability to control your blood glucose. So if your microbiome is completely out of kilter, then that's going to take a while to sort of, recolonize your gut properly and restore insulin sensitivity. Are you a stressed individual? If you're very high stress, then you're probably cranking out a lot of cortisol and a lot of epinephrine on a daily basis. And the result is that you're going to be living with a chronically elevated blood glucose. If you reduce your stress levels, that's going to have a really large impact on your ability to become more insulin sensitive. And so that being said, there's all these factors, but what we do see over and over and over and over and over again is that people living with all forms of diabetes are actually able to start to see improvements in their blood glucose in a very short period of time. Now, when I say short period of time, I mean within the first 24 to 48 hours is usually where most people start to see better numbers on their blood glucose meter. Okay, does that mean that insulin resistance is gone? No, not at all. What it means is that insulin resistance is starting to decrease. So the first 24 to 48 hours, that's what I experienced. And that's what a lot of people in our coaching program experience. And then it gets better after 3 days, and then a week, and then a month, and then 6 months, and then a year. So if I had to give an average length of time, I might say 6 months to a year to come fully reverse insulin resistance altogether. But all along the way, you're starting to see improvements in your blood glucose and a reduction in your need for insulin as well as oral medications.
This is great information. Why don't you give us an insight? What happens after 4 days of a Mastering Diabetes retreat? What do you see?
Okay, so at our Mastering Diabetes retreats, we see people of all shapes and sizes. And we have people that come with type 1 diabetes, people that come with prediabetes, and people that come with type 2 diabetes. And, varying levels of athletic ability, varying levels of a sedentary lifestyle, varying levels of stress. So it's kind of the whole gamut. After 4 days at one of our in-person retreats, we are able to improve the blood glucose values of almost every single person, almost 100% of all the people that have come through. And the reason for that is simple. Your primary, weapon, or your primary tool that you have at your disposal is your diet. Okay? So as a result of significantly dropping your fat intake, not to, 30% of your diet or 40% of your diet, I'm talking 15% of your diet in fatty acids at the maximum, somewhere between 10 and 15%. When you go from eating a higher fat diet to that level of fat intake in a short period of time, we see results very quickly. People with type 1 start dropping their insulin use. People with prediabetes start dropping their blood glucose. People with type 2 start reducing their need for oral medications in a short period of time. It's 4 days, and you think to yourself, what the heck can happen in 4 days? But trust me when I say a lot can happen in the first 4 days. And then if you continue those habits over the course of time, that's when it really becomes a true gold mine.
Okay, so some people think that they're too old to reverse insulin resistance, or that they've been eating a high-fat diet for too long to make any positive change. Is that true or false?
It's absolutely not true at all. I'll be the first person to admit that I used to think that same thing. When I was studying, doing my PhD, I noticed that a lot of the papers that I was reading were about, they were conducted in individuals that were in their 20s or their 30s, or sometimes as high as maybe, 65 at the most. And so I thought to myself, okay, well, the research indicates, the evidence shows that you can reverse these disease processes, whether it's insulin resistance, diabetes, cancer, hypertension, high cholesterol, atherosclerosis, coronary artery disease. These are reversible conditions using a low-fat, plant-based whole food diet, as we've described. But what happens to somebody who's 70, 75, 80, 85, 90? How come we don't read research papers about those people? And so I was under the assumption that maybe, it's not going to be as effective for that demographic because maybe it's too late. But what I've seen through empirical evidence or through people that have come through our coaching program is that it's literally never too late. It's literally never too late. And so, we have people who are 83, who are 78, some people who are in their 90s who start eating a low-fat, plant-based whole food diet, and they see improvements in their blood glucose, drastic improvements in their blood glucose in a very short period of time. And when I say drastic, I mean starting with a fasting blood glucose of 245 and coming down to a fasting blood glucose of 92 within 2 weeks. I'm talking about people that have been using multiple oral medications for 15 to 20 years and then have been able to reduce their need for oral medications within 1 to 2 months and completely get off of oral medication altogether. I'm talking about people that have been injecting insulin, living with type 2 diabetes for 10 to 20 to 30 years, who are able to get off of insulin or bring 75 units of insulin all the way down to 5 units of insulin per day within 1 month. So I used to believe that, there was a time limit, and once you hit that time limit, you can't do it anymore. But I can safely and confidently say that it's literally never too late to become an insulin sensitive machine.
I love that. That's great. Okay. What is the number one challenge you see people face when making lifestyle change, and how do you help them overcome that challenge?
I think the number one, it's funny. We've been asking the same question to all of our speakers. And now that I think about the question myself, I would say the number one challenge that I see most people make is that they walk into the idea of eating a low-fat, plant-based whole food diet with a certain set of assumptions in their head, which may or may not be true. So, from the time you're born until today, you learn a lot of information. You learn information in school, you learn information from talking to people, you learn information from reading billboards, you learn information through advertising, from reading books, you name it. And so all of that information kind of gets deposited in your head, and you walk around with this certain perspective on the world. Okay, the world is round, the sky is blue, the sun comes up every single day, the moon comes up, alternating with the sun, and you know certain things to be true. Now, in that process, I think a lot of people walk into this thinking, that can't possibly work. Like a low-fat, plant-based whole food diet, that's extreme. Nothing extreme works. Moderation's the key. Moderation's always going to work, right? They walk into it thinking, oh, well, if I'm eating plants, I'm not getting enough protein. That's a protein deficient diet. I'm going to either die, or something drastic is going to happen to me if I don't eat foods that are high in protein, such as meat and or fish and or eggs. And so it's this whole cloud of assumptions that, can easily be applied to this situation. And as soon as you start to read this material, you're like, that can't be true. That can't be true. That can't be true. That can't be true. And then even if, you've gotten to a point where you're like, okay, great, I'm willing to experiment, there's still a lot of unlearning that's required in order to actually fully experience a low-fat, plant-based whole food diet the right way. And so, I don't mean to sound pessimistic at all, but I am saying that, I had to approach a low-fat, plant-based whole food diet pretending like I didn't know anything about nutrition. And the truth was that I didn't know anything about nutrition. I didn't know a single thing about it. I didn't know if eggs were good for me. I didn't know if a banana was good for me. All I knew was that I felt terrible and I needed some positive change. So I closed my mouth and I opened my ears and I said, teach me everything that I can possibly learn and show me the evidence. Okay? Simply reading something that was printed in a newspaper is not good enough, because that's not primary evidence. I'm talking about reading stuff that's actually backed by scientific evidence. And once I got that information, I started to recognize, okay, there's a science to this. There's a science and it's actually true. And then after, listening and learning and learning and learning and learning and learning more, all of these assumptions that I was making in my head just started to go out the door, and they started to leave and leave and leave, to the point where I was like, you know what? I don't make any assumptions anymore, because all I can tell you is that my experience so far has been phenomenal. And I want to help other people also understand that their assumptions can sometimes block them from doing the one thing in the world that's actually going to make them the healthiest that they've ever been.
I love this. So the major solution to this challenge is for people to watch this summit.
Absolutely. I mean, there's no question that one of the most important things that you can do is watch the summit. Why? Because You know, you can believe me if you want. You can believe Robbie if you want. You can believe Dr. Barnard if you want. You can believe Dr. Greger if you want. I mean, the more you hear the same story over and over and over again, the more likely you are to potentially believe it, right? And again, it's not just because everybody has conspired behind a closed door to be like, hey, we should push this thing about low-fat, plant-based, whole food nutrition because it sounds kind of cool. We can make a lot of money off of it. Like, none of that, no. What people are saying is, hey, listen, let's tell people the truth. Let's tell people the truth because they deserve it, because there's a science about it, because it can transform their lives from the inside out, right? And when you see for the first time, when you feel just how much evidence and scientific backing there is for a low-fat, plant-based, whole food approach, when you read the books, when you actually understand just how much science there is, dating back to 1930 and before, it's hard to ignore. It's very hard to ignore that a low-fat, plant-based, whole food nutrition is not the most powerful thing that, you know, human beings have ever discovered about how to stay healthy in the long term.
This is great. Thank you so much for sharing your wisdom with us. It's really just a pleasure to work with you. And I know at the end of most of these interviews, we tell everybody, you know, to plug themselves, where they can find more information. And I'll just say, I think people should make sure to take note of our webinars. So we do a lot of webinars at Master Diabetes, and Cyrus covers a lot of these deep scientific topics that people are confused about, and they're free. And it's just another opportunity to learn more and more of what Cyrus is sharing and his science background. It's really brilliant stuff. So make sure to check those out. And, you know, thanks for taking the time to share this information with us.
Absolutely. Thank you so much. And, you know, being able to help thousands of people really make positive change to their, to their diet, the way they're feeling, to reverse insulin resistance, to drop oral medications, to drop insulin, or simply just, you know, gain energy and improve the health of their brain and their skin, whatever it is, you know, in any version of any of those improvements in metabolic health. To being able to provide that information to other people is something that allows me to go to sleep at night knowing that I'm doing something that really benefits a lot of people. And, you know, I wouldn't be able to do this without you. So thank you for all your help as well.